Asmar, and here is your question.
Okay, ma'am.
Right, so if you have read and understood, considering it history-taking station, kindly begin.
Yes, ma'am. Good morning.
Good morning.
Myself, Dr. Jatin. I'm one of the surgical trainees. May I confirm your full name and date of birth, please?
Name and age.
My name is
Save time. Yes.
my name is Mr. Smith. I am 43 years.
Nice to meet you, Mr. Smith. So today I'm here to ask you some questions regarding your illness. Is that okay with you?
You can go ahead, doctor.
Okay, so what brings you here in the hospital today?
Okay, doctor, I'm having this pains in my both legs. I have this pain just on the upper part of my leg, and it's worse when I'm walking, and then also in cold weather,
Mm-hmm.
it gets worse.
Okay, I'm so sorry to hear about this. It must have been very difficult for you. And
Yes.
yeah. So can I ask you some more questions related to this pain?
Okay, go ahead.
Okay, so for how long you are experiencing this pain?
Okay, doctor, I've had the pain for about 8 months now.
It's 4 months?
8 months, eight.
Eight months.
8 months. Oh,
Yes.
okay. All right. So is this pain present all the times or it comes and goes away?
It comes and goes away, doctor.
Okay. So can you please describe me how do you feel this pain, whether it is dull aching, cramping, sharp aching, sharp pain?
Okay, it's a sharp pain which I feel at my back, at the thigh, and then to the leg. I also have that pain in my leg as well, at the back of my leg as well. And the pain it comes and goes. Then when I walk, but when I rest, it reduces.
All right. So you having a pain in your legs at the upper part of legs for last 8 months, and you're
Yes.
saying it's also present in your back, right?
Yeah, no, not yes. Some once in a while I can have pain in my back,
Okay, once in a
but
while.
it's more in my legs. Yes.
All right, all right. So is this pain goes anywhere else, like to your feet, to your back or groin, in the groin, anywhere else?
Yes, it goes to my feet, doctor.
Okay. Have you got any trauma to your back recently?
No, I don't have any trauma to my back.
Okay. Have you noticed any weakness in your legs or feet?
Not essentially, doctor.
Any unusual sensations like tingling or numbness in your legs and feet?
No, I don't have presently that symptoms now, doctor.
Okay. Are you having any problem with your waterworks?
No, I don't have any problem with my waterworks.
All right. So have you ever noticed any break in your skin? I mean to say a wound or an ulcer of your legs or feet?
No, doctor. I've checked my legs. I've not seen.
Okay. And is there anything that makes this pain worse, like climbing up a hill or by doing some exercises?
This pain most times is actually worse in cold weather, but then when I climb uphill, it gets worse.
All right. And what makes it better?
Whenever I rest, I feel better. When I rest or I sit down or I take some rest, I feel better, doctor.
Okay. So can you please rate this pain from 1 to 10, 10 being the worst pain you have ever imagined in your life?
An 8. It can be horrible.
I'm so sorry to hear about this. How far you can travel till the pain stops you?
Well, it's when after working for some time, then when I rest, it reduces.
All right. So can I ask you some more questions? Like, have you ever met a GP in the past for any other medical illnesses like type 2 mellitus or hypertension?
Yes, I've met a GP in the past. I'm a non-hypertensive, I've been on drugs.
Do you remember the medicines?
Okay, presently now I can't remember the medicine.
Okay. Are you allergic to any medicines?
No, I'm not allergic to any medicine, doctor.
Have you undergone any surgeries in the past?
No, I've not had any surgeries in the past, doctor.
Can I ask you some personal questions?
Please do go ahead, doctor.
Okay. What is your occupation?
Okay, I am a driver.
With whom do you live at home?
Okay, I have a partner.
Okay. Do you take alcohol or smoke?
Yes, I smoke alcohol. I take alcohol and I also
Can you
smoke.
summarize your history now, please?
Thank you so much. So, Mr. Smith, 43-year-old male, presented to me with the chief complaints of pain in by both the legs, which is intermittent in nature and which is he is experiencing from last 8 months. The patient, the pain gets aggravated by on moving uphill, and it gets also aggravated on the with the cold weather, and it gets relieved by rest. And there is no history of any back injury, any involvement of any muscle weakness and sensory changes of the limbs. So based on my history,
Yes, you have to mention the distance that patient comfortably covers in one
yes,
go before taking rest. So
yes, patient covers 50 meters before
with
taking
ease. Yes. Okay.
with ease.
Now
And
kindly
patient
tell
is
me.
smoker.
Yes. Okay. Right. So now kindly tell me your provisional and differential diagnosis.
So my provisional diagnosis is chronic limb ischemia, which is secondary to secondary to vascular involvement, as the patient is smoker.
Yes.
So it's a
What are
vascular
the
claudication.
what are the other differential diagnosis you'll
I would
consider?
like to keep the disc prolapse, lumbar canal stenosis.
Yes.
Or it could be a diabetes mellitus.
Yes.
Or any osteoarthritis of the knee.
Okay. What investigations would you ask for to confirm your diagnosis?
First of all, I would like to go for the clinical examination, which will involve the neurovascular examination of lower limbs.
Yes.
And then I will assess the gait, and then I'll go for the routine blood examinations, which will involve the full blood count, CBC, full blood count, LFT, KFT, and some specific investigations like blood glucose and lipid profile of the patient. And then I would like to go for the color Doppler, arterial and venous studies of the lower limb, and CT angiography and MR angiography of the lower limbs.
What are the treatment alternatives or options can be offered to the patient?
First of all, I would offer the conservative treatment, in which first I will advise the lifestyle modification, that is smoking cessation.
Very good.
And then to do the optimization of the blood diabetes mellitus and the hypercholesterolemia.
Very good.
Uh,
Yes.
and then the medical management, which will include antiplatelet aggregating drugs like
Yes.
aspirin and clopidogrel, and anti-hyperlipidemic drugs
If
like
medical
simvastatin.
treatment fails, then what can you offer to the patient?
If the medical treatment fails, we can go for surgical treatment, which includes the endovascular stenting
Very good.
or any bypass grafts. And if there is a patient is having gangrenous changes of any tissue, we can go for amputation of that
Right.
tissue.
Yes. Which was not the case in this one, but if
Yeah.
fails, then yeah, can be done. Very good. Okay. If time would have allowed you, how would you have completed your history?
If time would have allowed me, I would have taken the family history and the drug recreational drug history, and also the ideas, concern, expectation of the patient.
Yeah. Did you ask the past history? I think you were asking, or you haven't asked the past medical history.
Past, I covered the patient is
And
hypertensive.
systemic disease. Yeah. But then past surgical history, if a patient has been operated or if there is any other condition. Okay. So yeah. All right. Thank you.
Thank you, ma'am.